are listening to Star Podcast.
So September is known as Gynecological Cancer Awareness Month. Now what does gynecological cancer mean? It means cancers that are related to the female reproductive organs. If we divide the type of gynecological cancers into 5 categories. 1. Uterus, or what is called as a bachedani, ovary, or what is called as a andedani, and parts of the uterus, which is vaginal cancer, vulval cancer, and cervical cancer. Rarely, the fallopian tubes can also be affected with cancer. The commonest cancers in India, in terms of gynecological cancers, are ovarian and cervical cancer. The best way for early detection of any cancer is being extremely conscious of your own body and being aware of the changes that go on in it. You need to know the common symptoms of gynecological malignancies: abdominal bloating or any sort of swelling, feeling full immediately after eating, excessive weight loss, which means that a weight loss of more than 10% of your general body weight in the last 6 months, any sort of pain or discomfort in the lower part of the abdominal or the pelvic region, feeling extremely weak and tired all the time, lower backache which is not subsiding despite taking medication, any sort of constipation or diarrhea, which is changes in bowel habits that are persisting despite taking medication and dietary changes. So the best way for early detection of gynecological cancers or any cancer in general is being conscious and aware of your own body. You can start with knowing the common symptoms of gynecological cancers: any sort of abdominal bloating or swelling, quickly feeling full once you eat a meal, excessive weight loss, which means that more than 10% of weight loss of your normal body weight in the past 6 months, any sort of discomfort in the pelvic area or the lower part of abdomen, feeling tired or fatigued all the time, lower backache that is not subsiding despite rest and medication, any changes in bowel habits, which means like sudden onset of constipation or diarrhea, which is not subsiding despite medication and dietary changes, a frequent need to urinate, which means that increase in frequency of passing urine, very, very important for gynecological malignancies, any sort of irregular menstrual bleeding, which means that any spotting or bleeding in between your cycle, any history of postmenopausal bleeding, which means that once the menstrual cycle has stopped, you suddenly begin to pass blood per vaginum, which is postmenopausal bleeding, or even spotting in between your regular menstrual cycle, you need to get it evaluated and checked. Excessive vaginal discharge needs to be evaluated. The vulval region, any changes in the skin color or any growth or rash or sores or warts in that area, they need to be checked by a physician and then proceeded accordingly. Let's have a look at individual risk factors of the various kinds of gynecological cancers. For cervical cancer, what increases your risk? Definitely one of the most common risk factors is having an infection with the human papilloma virus. Also, smoking increases the risk of cervical cancer. With increasing age and decreasing immunity, risk of cervical cancer increases. Having multiple sexual partners, long-term unregulated use of oral contraceptives, and excessive weight gain or obesity increases the risk of cervical cancer. When we look at ovarian cancer, it does have a genetic predisposition. Any sort of mutations in the BRCA1 and BRCA2 genes increase your risk of ovarian cancer. Having a personal or a family history of breast cancer or colon cancer raises your risk of even getting ovarian cancer. To know more details, please consult a genetic counseling specialist. With increasing age, the risk of ovarian cancer increases. Infertility, that is not having children, no history of pregnancy, obesity, and hormonal replacement therapy, which is unregulated, not consulted by a physician, increases your risk of ovarian cancer. Talking about uterine cancer, also known as endometrial cancer, increased risk factors: use of a drug called as tamoxifen, excessive weight gain or obesity, again hormone replacement therapy, only estrogen without progesterone supplementation, unregulated, without the consultation of a physician, can increase your risk of uterine cancer. A family history of uterine or colon cancer, even having multiple comorbidities like diabetes mellitus, not being in the best physical health of yourself, can increase your risk of uterine cancer. If for any reason you've had a prior history of pelvic irradiation, it can increase the risk of uterine cancer. Talking about vulval and vaginal cancers, definitely having previous infections with the human papilloma virus increase your risk of both vaginal as well as vulval cancer. A history of smoking, being immunodeficient, that is low immunity, any skin lesions or warts or rash, or a family history of a skin disease called as melanoma can increase your risk of both vulval and vaginal cancer. A history of cervical cancer also increases the risk of vulval cancer. One very good thing about gynecological cancers are they can be prevented. They can be prevented by various lifestyle modifications that you can inculcate in your daily life. Taking a healthy diet, weight control, exercising regularly, keeping your stress levels in check, routine checkups with your physician and gynecologist, knowing your family history, very, very important, being aware of it and getting genetic counseling if necessary, and always taking hormone replacement therapy after consulting your doctor. Never self-prescribe hormone replacement therapy. And extremely important of the lot, as a preventive measure for both cervical and vaginal vulval cancer, take the human papilloma virus vaccination. Now, how is cervical cancer linked to the human papilloma virus? 80% of all the cases of cervical cancer are caused by an infection with the human papilloma virus. How does it affect it? If you have an infection with the HPV virus, it causes changes in the lining of the cervix, which is the cells of the cervix that can bring about something which is called a cervical dysplasia, and long-term exposure can actually get converted into cancer. So depending upon the type of gynecological cancer, various treatment modalities are available, be it surgery, chemotherapy, radiation therapy, immunotherapy, or even latest surgical techniques such as HIPEC. For cervical cancer, depending upon the stage, you can go ahead with upfront surgery for an early cervical cancer or a combination of radiation therapy with chemotherapy. Brachytherapy, which is also one of the latest techniques, is available for cervical cancer treatment. Uterine cancer or endometrial cancer, again, depending upon the stage, you can go ahead with upfront surgery followed by chemotherapy and radiation therapy, or depending upon the stage, chemotherapy followed by surgery. For vulval and vaginal cancers, again, it could be surgery followed by radiation therapy, if required, chemotherapy as well. In case of ovarian cancers, you can go ahead with chemotherapy followed by surgery followed by chemotherapy, which is called as interval cytoreductive surgery. You can also use a latest technique which is called as HIPEC in surgical terms, which is hypothermic intraperitoneal chemotherapy, which helps at curing your disease and preventing recurrence or the disease from coming back as well. Gynecological cancers are hereditary. Having mutations in the BRCA1 or BRCA2 genes does make you susceptible to various gynecological malignancies, especially ovarian cancer. So know your family history, get routinely checked, and seek counseling from a genetic specialist if required. What are the various lifestyle changes you can take to reduce your risk of gynecological cancer? Definitely healthy eating, a stress-free life, exercise regularly, take the HPV vaccination, keep your weight in check. Thank you.
Thank you for listening to Star Podcast.